Bleeding while passing stool or vomiting blood can be a serious sign. It is worrisome for both the patient and physicians because it could portend a diagnosis that is very sinister. You may have bleeding as a result of cancers, but it simply could be because of hemorrhoids or ulcers that are easily treated. One of the causes of massive lower gastrointestinal bleeding is diverticular disease. This results from long-standing constipation and it usually affects the elderly in the elderly population. The bleeding can be significant and it may be life-threatening. One of the ways that we diagnose it is via colonoscopy, which basically involves cleansing the colon and then passing a camera up the rectum and going all the way around, and we can actually look on the images of the inside of the colon, and this is recorded, and we are able to see exactly if there's any diverticular disease, if there's any polyps, if there's any cancer, and we can biopsy any lesions or remove polyps and actually in those situations stop the bleeding. So it's very important that we look out for any bleeding. It could be a serious problem that is causing the bleeding, and it's best to get early intervention, and one of the ways we do that is via colonoscopy. Screening for cancer of the colon or cancer of the stomach is very important as we get older. Over the age of 50, it is recommended that you get a colonoscopy. The colonoscopy basically will look for the lesions that are going to turn into cancer over a period of time. These polyps, as they are called, are slow growing usually. So if you take out the polyps before it gets to the cancerous stage, then you can prevent yourself from getting cancer. Usually you're asymptomatic, meaning you're showing no symptoms of the disease, but this is why we call it screening, because that's a population that you want to get the disease processing at an early stage so you can actually prevent progression of the disease.